Trev, so we're going to run through what we call the SFMA. It's just a movement screen. It's going to let us know if you have any dysfunctional movements. I just need you to follow my lead and let me know if anything's painful. So to start, you got your shoes off, which I like to see. You haven't had a warm-up, so we can begin. So the first thing I need you to do is we're going to test your cervical flexion. You're just going to bring your chin to your chest. So if you want to face the other way, okay. All right, so as far as you can go?
Mm-hmm.
All right, any pain with that?
Kind of hurts.
Okay, so it looks like you're lacking a little bit of motion, all right? So the next one we're going to do is cervical extension. So you're going to bring back, try to look at the ceiling as high as you can. Any pain with that?
Not really.
And you're definitely lacking a little bit of motion with there. We want to see within 10 degrees horizontal, and you're pretty far off of that. So the next one, you have cervical rotation. So you're just going to stand, you're just going to turn your head to the left. Make sure you're only looking left and right, not up and down. Try to bring your feet together a little bit closer too. There you go. So you want to look that way for me? Good, you're looking within the 80 to 90 degree range. There you go. And now can you look to the other side? Any pain?
No.
No? Feeling good?
Mm-hmm.
Alright, good. So that's it for the neck. So we're going to do a little shoulder screen here. So what you're going to do is you're going to reach with your right hand. You're going to reach back and try to touch what we call the spine of your scapula, this bone right here. Try to reach onto the opposite side. Any pain with that?
No.
No. Very good. Now can you do the other hand? Is that as far as you can reach?
Mm-hmm.
Yeah. Alright. Pretty good. Painful?
No.
No. So now what we're going to do is internal rotation, the opposite motion. You're going to take your arm and you're going to reach up your back. Like that. So what we're looking for is the inferior angle of your scapula, this little bony bump right there. Wow, it's looking real good. Any pain?
No.
Very good. Now the other hand. Pain with that?
No.
Alright, nice. That's it for the shoulder. So now we're going to do some trunk mobility. So we're going to do multi-segmental flexion test. So what I need you to do is bend over, try to touch your toes. It's looking really good. Just check out your sacral angle here. Everything's looking good. Your weight shifted posteriorly. Everything we're looking for. You can come back up. Is that painful?
No.
Nice. Now we're going to do the extension test. So you're going to lift your arms up in the air and you're going to lean backwards as far as you can. What we're looking for is the inferior angle of your scapula is coming behind your heels. That's looking good. Any pain?
No.
Nice, nice. All right, now we have the rotation test. So what you're going to do is try to look behind you as far as you can. I want to see equal involvement with your upper trunk and your lower trunk. Any pain with that?
No.
No? Good. You want to bring your feet just a little bit closer? Thank you. And now can you turn the other way? How's that feeling? Painful? Okay, looks like you have a little bit of upper trunk mobility compared to your lower trunk, but that's something we can talk about a little later. So that's looking all pretty good. So now we have the single leg stance test. So what you're going to do is lift one leg in the air like that and try to maintain it for 10 seconds. All right, very good. Now you can switch legs. I'm assuming that's non-painful. Very good. Alright, and you can relax. So that's looking good. What we're looking for there is any losses of balance or changes in weight shift or anything, but you look real stable, so that's good. And now we're going to have you do the same thing with your eyes closed this time.
Okay. Can I close my eyes after I get in?
Yeah. So get in position, close your eyes. I'll be here to guard you. Alright, definitely a little harder, but you get your balance there, so that's good. Now you can just do the other leg. Alright, good job. And the last one is just the overhead squat. So you're going to reach your arm overhead. You're going to come down and try to pretty much just do a squat. Stick your butt out. You want to keep your trunk as upright as possible. You want to keep it vertical. You want to avoid coming down horizontally like that. And keep your heels on the ground, and let me know if you have any pain with that. Actually, better than I expected. Good job. Any pain?
Nope.
Well, nice work. You can come up. That's it.
Okay, so we found some limitations with our top tier assessment with the SFMA, particularly in the cervical spine. We're just going to address one of the issues here, which will be cervical flexion. Just so we can show you what he looked like in standing again, can you turn to the side and try to touch your chin to your chest again? Okay, so he's definitely limited there. So now what I want you to do is I want you to lay down here on your back with your head over the edge here. So now that he's in a gravity limited position, I want to see if he can do it himself. So again, try to touch your chin to your chest there. Good. Any pain with that? Yeah, a little. Okay, come back down. Now I'm going to try to move you. Let me know if there's pain. Okay, so there's pain and there's still limitation here. Alright, so come back down, just try to relax here. So now we're going to assess the OA joint here. So what I want you to do is I want you to rotate to the right yourself, and now try to touch your chin to your clavicle over there, which is this bone right here. So go ahead and try to bend and touch that. So he's not limited there. Are you painful there or no?
No.
Okay, now try the same thing in the opposite direction.
Nothing.
Nothing. Okay, so the OA joint isn't limited, so we're thinking it's either a tissue extensibility dysfunction of the lower cervical spine or a joint mobility dysfunction there, and we'll treat accordingly. So we don't know if our patient has a tissue extensibility dysfunction or a joint mobility dysfunction or both, so we're going to assess for both. So what I'm going to do right now is I'm going to assess the mobility of each cervical segment. What I want you to do, oh, looks like you already know what you're doing here. Just try to relax as best as you can. So what I'm going to do is I'm going to flex him forward to lock out the upper cervical vertebrae. I'm going to stabilize one of the lower cervical vertebrae, say for this case C4, and I'm going to move his head backwards, so it's as if C3 is moving on C4, so I'm testing the mobility of that segment. You okay with this?
Mm-hmm.
And I'm going to consecutively go down the lower cervical vertebrae to test for mobility issues of each segment. So that's that. So now we are going to assess the tissue extensibility dysfunction our patient may or may not have. So in order to do that, just relax here. I'm going to get a nice stretch on the upper trap here to assess its integrity. Is this painful for you here?
Mm-hmm.
Okay, and this is something the patient can do at home. They're going to hold it for about 30 seconds. And they're also going to do it bilaterally, of course. And now we're going to do levator scap. We look at your pocket right down there on the left. And again, get a nice little stretch on it. Is this painful for you here?
No.
Okay, good. So this is, again, something that he can do at home, 30 seconds bilaterally. And we're also going to have the patient do some active range of motion at home, too. So after he's done stretching, maybe try to actively touch his chin to his chest. You okay with that, sport? We stretch the muscles out and increase the joint mobility here. We're going to work on some postural correction exercises. So, Trevor, what I want you to do here is I want to make sure that you're squeezing your shoulder blades nice and tight together, and I want you to try to tuck your chin towards your chest. Really trying to drive this towel into the bed here, or the table. Alright, so I want you to hold that for 30 seconds and then relax. So this is going to facilitate good posture at work and just with everyday activities.